Welcome to our Fireside chat for our diabetes care program, this time to coincide with the World Diabetes Day. My name is Claudia Martínez, and I lead our work on access to diabetes care here at the Access to Medicine Foundation. And today we're here to talk about a very important topic: how to promote holistic access to essential diabetes care products through the continuum of care. We're focusing on low and middle income countries where we know that 3 out of 4 adults living with type 1 diabetes live. And we also know that people living with diabetes require regular, reliable, and affordable access to a range of essential products. And while the discussion tends to focus, rightly so, on treatment and insulin, we also know that people living with type 1 diabetes and type 2 diabetes do require access to a range of healthcare products, including glucose monitoring devices and also associated commodities like syringes and also the needles. These are critical for people to be able to appropriately manage their condition, but we know that in many countries, and particularly low and middle income countries, many people won't have access to them. So I'm very excited to be joined by this amazing panel of experts today to talk us through some of these issues and challenges, but also solutions. And today's discussion is going to touch upon 2 areas. First of all, we want to understand the perspective of people living with diabetes, really put that front and center, and understand also some of the obstacles that they might encounter and the factors that actually contribute to being able to get access to some of these treatments and devices. Secondly, we want to hear about multi-sectoral initiatives. Our panelists here will be presenting their organization's strategies and some of the achievements in advancing this holistic access to diabetes care. So I'm very excited to hear from those initiatives and programs. And with that, I would like to kick us off with this very exciting program and with our panelists here. So I'll do a quick round of introductions so you know who's joining us today on this Fireside chat. We have Dr. Edward Kariithi, who is a Kenyan medical doctor with 15 years worth of experience in integrated health project implementation for organizations such as USAID, Centers for Disease Control and Prevention, National Institute of Health, and also various private sector donor entities. He currently serves as the Programs Director for PATH in Kenya and the NCD Lead for the PATH Kenya Country Program. In this role, he provides the technical implementation and support for NCD projects, including the Diabetes Care Pact project that we will hear about today. So I would like to welcome you, Dr. Kariithi. Thank you for joining. Second, we have Emma Klatman. Yeah, thank you so much. Who leads Life for a Child's global policy and advocacy programs. Nice to have you here, Emma. She's a leader within the type 1 diabetes community and collaborates with diverse stakeholders on advocacy, policy, research initiatives also on topics including access to care, health systems, cost effectiveness, and also psychosocial aspects. Emma has wide experience in strategic collaboration, which is something that we want to hear about today. And she's working to really bridge those gaps that we see in access in diabetes care between high and lower resource settings. Last but not least, I'm very happy to welcome Nupur Lalvani, who is founder and director of the Blue Circle Diabetes Foundation, which is a registered NGO and the largest support group for people living with all types of diabetes in India. She also lives with type 1 diabetes for the past 28 years. So very, very happy to have you all here, and I want to welcome you. Perfect. So start by posing all of you, and I would probably with Nupur and get some thoughts, right? So in our work at the Access to Medicine Foundation, something that we have observed is the importance of these multi-stakeholder partnerships. We know that in collaboration, in dialogue with manufacturers, with industry, with global health organizations and local implementers, the solutions to enabling access, we know they don't sit with just one single person or So I wanted to panel, maybe starting with Nupur, Emma and Dr. Edward. How do you see these multi-stakeholder partnerships being valuable and to improving access to products? And when I mean products, both treatment and devices.
All right. Thank you, firstly, for having us here and for this opportunity to speak. I think that access to diabetes care, especially in low and middle income countries, is at best some sort of patchwork of effort. It's well intentioned, but sometimes it can miss the mark, and if there is no sort of coordination, or if there's no multi-stakeholder approach to the whole problem. And the diabetes continuum of care, from diagnosis to management, prevention of complications, it needs not just treatment, or not just medical care, but also monitoring devices, access to all of these things, community support, education, a lot of factors which are essential for management of the condition. And that's where multi-stakeholder partnerships can really bridge the gap. They can provide funding. Uh, Governments can provide funding and work on policies. Healthcare providers can sort of engage and provide insights on patient needs. Communities and NGOs can, talk about engagement and education, and the private sector as well has a role to play by creating affordable products that those living with diabetes and LMICs can use. So I think together, it all of these stakeholders really come together to form the spectrum of care, right from insulin to glucose monitors, CGMs, and pumps, and so on and so forth. Um, so like I said, it's way beyond just medical needs. We've also got to look at the social determinants. We've got to look at health literacy. We've got to look at language, which can often be a barrier. We've got to look at infrastructure, transportation. It's not just enough to provide supplies to somebody that lives with diabetes. It's also important to empower those people to use the supplies effectively. So I think I'll pause here. Thank you.
Fantastic. Thank you. Thank you, Nupur. I think that's really valuable. And I'm curious to hear from Emma and Dr. Edward, if you think that something else is missing from what Nupur has mentioned. Are we going far enough, I guess, with these partnerships and this collaboration? So over to you, Emma.
Thank you so much, Claudia. And I think the fact that, Nupur, Edward, and I are here in this particular way, in this particular setting, just kind of speaks volumes to the way that the momentum is continuing. And I couldn't agree more with what Nupur has said. And I think that we all should be taking a critical focus on this. I think that, if we look since 2021, following the centenary and the prioritization of meaningful engagement of people living with diabetes, we're absolutely seeing a pinnacle moment for access to type 1 diabetes care. I would fully say that there is a huge window of opportunity for, yes, of course, the T1D global ecosystem, but beyond that. And to Nupur's point about, ensuring multi-stakeholder collaboration, I think the thing that's missing that you asked, Claudia, is selling, if it were, the shared vision of success, because there's no deficit of goodwill here. It's just about how do we crack that point. When we see all of the commitments that have been made since 2021 to increasing access to care from very big and diverse players, I'll just remind those tuning in of those. We've seen commitments to reach more young people living with diabetes through various international donation programs, Life for a Child being one of those groups. Of course, we've seen the WHO global diabetes targets that say 100% of those living with type 1 diabetes need affordable access to both insulin and test strips. I think we've also seen, this uncovering, and it's still being uncovered, of huge epidemiological data gaps in an effort really to find out how many people with diabetes there would be if they had access to care at varying levels. I think we've also seen private sector commitments to pre-qualification, for example, and one thing that's very pertinent to Life for a Child at the moment is the policy level changes that we've seen on the essential diagnostics list. And really, this win here for seeing meters and strips as part of self-monitoring of blood glucose rather than using meters and strips, solely in the health facility setting. And I think also think about the advancements on the essential medicines list with access to analogs and insulin pens. And just one other thing I'd like to say is that with all these incredible milestones being reached, I don't think any of us would say that the momentum is losing steam here. I think it's accelerating. But as Nupur was saying, just because it's accelerating doesn't mean that there isn't room for improvement and taking a critical hat on these things. And one really important thing to me is that we continue to kind of push the envelope, as it were, on creating these pioneering partnerships between people living with diabetes and even the private sector. It may sound unorthodox, but if you look at the recent win with the essential diagnostics list, the SAGE IVD committee in their comments said that, our application was the only one to receive public comments and support from the lived experience community. And I think that when we see global agencies really legitimizing more and more so, there's more to be done here, legitimizing the voice of lived experience when it comes to even policy, I think should be really motivating for people living with diabetes. And it should also, I think, put pressure on bigger organizations to empower those voices as well.
Thank you, Emma. I think everything that you've said really resonates. And I wonder, Dr. Edward, perhaps if you have a comment on this dynamics and this momentum that we have seen, the fact that we still see gaps. Do we see indeed the voice of people living with diabetes more represented in these discussions? Are they being part of these partnerships? And how do you see this evolving, I guess?
Yeah, thank you very much. And thank you very much to our discussants, Nupur and Emma. I commiserate with all your thoughts, especially looking at improving access to products essential to diabetes continuum of care. And for us, and especially for us who sit in clinical practice, is really looking at the exponential rise of NCDs, and particularly when you look at diabetes, you begin to see that exponential rise, particularly because if you look at adults, it's estimated that the burden of diabetes in adults will more than double in the next 30 years. And again, that just serves to show you the quantum of what we are dealing with, vis-a-vis now what we have spoken to in terms of the response or the momentum or the increased commitment to basically serve NCDs and particularly diabetes. So again, just to say that, yes, we recognize that push towards increased commitment, but does it quite match the exponential rise in NCDs, and particularly for diabetes, where we're looking at more than double the diabetes burden in the next 30 years. But all is not lost. Already we are beginning to see those commitments that you have spoken to. And for us, especially in the Kenya space, we are lucky that we are beneficiaries of some of these broad partnerships, such as the Coalition for Access to NCD Medicine Products, also the WHO Diabetes Compact, the PEN Plus Initiative, and then, of course, there's a WHO Global Action Plan that also includes the global NCD targets. We work very closely with the NCD Alliance and the country alliances, and PATH in Kenya is part of the NCD Alliance in Kenya. And then as a country, aligning with the United Nations High-Level Meeting on Universal Health Coverage. All this speaks to what you've spoken to, Emma, that indeed we are part of those partnerships as individuals, as personal lived experiences, as implementers, but also as governments, really to try and push the envelope. But do those commitments match the rise in NCDs, and particularly for diabetes? If you look at Kenya, in terms of diabetes, Diabetes is one of the top 10 leading causes of death in Kenya. In fact, it's number 6 if you look at the WHO Global Health Observatory or the Global Burden of Diseases. It speaks to number 9 in other globally. But when you look at Kenya, which is a upper middle income country, is at number 6. So you begin to appreciate the burden of diabetes and its contribution to mortality. And what contributes to that increased mortality, particularly in our setting as an upper middle income country? I will tell you for a fact that the biggest challenge is access to consumables, not the insulin, access to consumables. So the consumables that you spoke to, glucometers, syringes, lancets, the strips, really to be able to provide the medicine, which is insulin, is our biggest problem. So access to those consumables. Just to put it in context, our next big problem here, especially in diabetes space, is the education of patient education and patient education towards healthcare. And then insulin only becomes number 3 in terms of what are the challenges in terms of really providing that diabetes care. And of course, for us in our Kenya context, just for context, number 4 is delayed screening. About 50% of our cases go undiagnosed. So just to show you the quantum of the problem in terms of access to these consumables. And for us is largely around affordability and availability of those consumables. Thank you.
Thank you very much to all of you. And I think, Dr. Edward, you are nicely set us up for the next question that I have, which is, you've clearly outlined in the context of Kenya, what are the main challenges, right? What is needed? And I wanted to turn to Nupur, actually, to ask you if you could tell us a bit more about your own journey as a person living with diabetes. How has it been, and what has been the experience of accessing some of these essential healthcare products? And also, perhaps, what do you feel have been facilitating factors and also initiatives that have helped you in this journey?
Thanks, Claudia. So I think that, is going to cover a vast sort of spectrum of topics. Living with diabetes is a constant balance of various factors, constant monitoring, dosing, planning, food, and of course, a search for accessible care and, life-saving products. Access to diabetes care is a fundamental right for everyone, and yet it remains a challenge for many people, particularly those in low and middle income countries. I've personally struggled with the cost of insulin. I remember when I was newly diagnosed, my family would we used to cut the test strip. This is unheard of, but we would cut one test strip, which would result in 3 test strips, and saving of a little bit of money. So, so these are challenges, and we've accepted them as normal, and we live our lives. But certainly, I think we all acknowledge that there is an overwhelming sort of complexity to managing living with diabetes, and each day is a balance between all of these factors to maintain not just blood sugar levels, but also everything else, the social, the cultural, the financial aspects of the condition. And but I think amidst these stories, I one story that I wanted to share was that of 11-year-old Tanisha, a member of our community. She loves Bollywood songs. Her father is an auto rickshaw driver, and she's one of 3 daughters and lives with type 1 diabetes. And our, through our foundation, we support Tanisha's not only her supplies and her lancets and her strips and the glucometers, but we also support her with mentorship, where we provide a mentor, or what we call here in Hindi, a didi, like an elder sister that lives with type 1 diabetes and supports and guides Tanisha and her family through, the complexities of not just dosing and discussing, blood sugars, but also several other things. How do you, socialize? Where do you, when you meet friends, how do you take your insulin and things like that, and while we were talking with the family, we realized, the mentor actually realized that we thought we were doing a good job, providing them with the things they needed, up until the point we realized that the family does not own a refrigerator, and that's when we sort of, stepped in, bought them a small fridge that they could plug into their little house. And there's so many things that go on with the management of diabetes, and of course the parents have to look after other children in the house, things like that, so affordable healthcare is definitely, I think, the crux of this point here. There are multiple organizations. Of course, there's Life for a Child. There's several, entities, and I really wonder where we would be without the support and care that these entities provide kids and people that live with type 1 and other types of diabetes. There are also technological innovations that we hope in the near future can be not just available but also available and accessible for a majority of the population. For instance, generic insulin or biosimilar insulin, that's now getting popular, and I know that Access to Medicine Foundation also, works on this. And I'm a user of generic insulin, and I've been so for the past several years. I didn't know that. I didn't know of this concept until a few years ago, and when I realized, and for somebody living with diabetes in India, well, most people are paying out of pocket. So for something that helps me save some money and others, I think it's wonderful, right? So we wrote blogs about it, we made videos about it in multiple languages, we shared these with our community. Apart from all of this, like Dr. Edward was mentioning about the education as well being something lacking, and so another initiative that we have is that we have these online workshops that we have every Sunday. So people are ready and they're used to. For the past 3 years, we've been running these online workshops, and we call them Blue Circle workshops. They happen on Facebook, as Facebook Live, by people living with diabetes and for people that live with diabetes as well. So I think education is something that, in the whole context about access to supplies, is something that sometimes we tend to forget. As well. And I think a lot of things such as stigma also can be addressed by the right education and awareness. So I think the goal really, one of the goals of our organization is to be able to reach out to people who are at that intersection of, economic disadvantage, social disadvantage, barriers that are to do with language, because there are multiple languages in India, which is another challenge. Not everybody understands English or Hindi or some of the common languages, and to really be able to work towards the goal of health for everyone. So it's not just a solitary thing. I think like Emma was saying earlier, the intention is there. It's just about bringing all the stakeholders together, putting in that sort of collective action and understanding to make diabetes care accessible for everyone.
And yeah, thank you so much. I think you've really captured, I guess, the focus of this discussion, especially the fact that it's not only about accessing treatment and devices and everything you may need. Like the educational piece is extremely critical, right? And that's not something that we can neglect in any shape or form. I wanted to turn to Emma to tell us, so a couple things. Everyone will be very familiar with the Life for a Child program, but could you tell us more about the journey and the activities of this particular program, your experience of really partnering with the private sector? And I also wanted to pick up on your comment again on the significance, I guess, of monitoring. And you were talking earlier about the inclusion of glucometers on the essential diagnostics list. How do you see this change? What else is needed? So if you can tell us a bit more about that.
Of course. I should also mention that I have lived with type 1 diabetes for over 25 years now. And so I grew up in, a well-resourced country. I never had to really think twice about where my supplies would be coming from. That was a burden that was, usually on my parents, but being from, living in a high resource setting, it wasn't, wasn't top of my parents' mind to be worrying about at the time. But that being said, access to affordable care is just one component of, the whole ecosystem that can empower people living with diabetes to live good days and survive and thrive. I grew up in a time where language didn't matter that much when it came to going to clinics. And I think that's something, some people say that, diseases across the globe can be the great equalizer, drawing common threads between those who have lived experience. But I actually don't think that when it comes to diabetes, obviously, because, social determinants of health and socioeconomic situations vary so much. But when it comes to the impact of language being used in the clinic, and the clinic not feeling like the safest of environments for people living with diabetes, where they ultimately go to receive care and to be empowered and looked after. You can have access to the greatest insulins in the world. You can have access to pumps. You can have access to consumables without worrying about the financial impacts. But without empowered language and safety in the clinic, those consumables, affordable products can only go so far. So I would just say to Nupur's point about, just how critical education is. It is so critical. It is not the cherry on top of, once we get access to insulin solved, then we'll worry about education. Then we'll worry about language matters. They're all interweaved. So I just wanted to start by saying that. And then when it comes to the recent news about test strips and the essential diagnostics list, I'm no fool that just, having products on a list alone, that's not going to change the game overnight. But there are mechanisms, complementary mechanisms as well, like I'm not sure we have so many details about this yet, but pre-qualification of test strips. When you look at that and what the future of that is on the WHO level with this, the anchor of test strips being seen as essential now, I think that can only strengthen things. But I do think there's much more work to be done when it comes to supporting countries in their own national diagnostics lists. Essential medicines or diagnostics lists are not published every year. And I know a number of countries are publishing their lists, and it's really critical that these lists are supported by, civil society actors and advocating for the inclusion of products that, it's not rocket science when it comes to access to what's needed for type 1 diabetes care. Insulin is, as you said, Claudia, is obviously the thing that keeps people alive with type 1 diabetes and insulin indicated type 2 diabetes. But I've said this before, having type 1 diabetes and just having access to insulin with no strips or intermittent access to strips is kind of like having a really nice television, but either having no remote to turn it on with or having a remote that has crappy batteries in there that don't always work. You cannot make decisions without, knowing what your glucose levels are. It's not helpful, it's dangerous, and, evidence shows that reduced frequency of testing one's glucose levels correlates to higher HbA1c levels, which is, can result in devastating outcomes, premature outcomes for young people with diabetes who really are given no chances in their lives because of this completely unavoidable fate. So I'm very passionate about test strips. I know Nupur is, I know Edward is. We're all really passionate about this. And I think as access to CGM becomes much more prevalent and on the standard of care for type 1 diabetes, I think it's critical that we don't mull over or skip over access to an older technology. And I'm not going to pretend to have all the answers here. It's one of those things that keeps me up at night wondering what will happen, to test strips in terms of technological phase outs. But that being said, I do think, we should be thinking about leapfrogging opportunities to CGMs, potentially in the future, disruptive and innovative forms of CGM too, because, in the past, maybe access to a landline phone didn't exist in certain less resource settings, but there were leapfrogging opportunities and moments where access to cell phones became the norm. And so I think thinking about the leapfrogging opportunities is important here. And it's not just symbolic. CGMs are a game changer when it comes to type 1 diabetes management. I'm conscious I haven't really talked about Life for a Child and our activities, but I don't want to take up too much time. I'd be happy to talk a little more, but maybe in the next opportunity so I can give Edward a chance to speak.
Fantastic. No, thank you. And I think you've touched upon many very, very important topics. I just want to give Dr. Edward an opportunity to perhaps react to some of the discussions that we've been having, but also I want to pose a question. So Dr. Edward, like the Diabetes Care Pack initiative specifically focuses on addressing some of this fragmentation, right? So actually trying to enable this continuum of care. And I would love to hear your insights on how this process has been and some of the work that you have done in country and how the implementation has gone. And also, how do you see things like Diabetes Care Pact contributing to closing some of these gaps?
Yeah, thank you very much. And thank you, Emma and Nupur, for articulating the issues around access and availability of these products that we need to be able to administer insulin safely. So recognizing that access is the challenge, and particularly access to these products that would enable safe administration of insulin, one of the things that PATH has brought forth is the Diabetes Care Pack initiative. The Diabetes Care Pack initiative speaks to using the use of what we call a human-centered design to develop those kits of supplies that you need as a person living with diabetes to safely administer insulin. These products and bringing them together in a kit is not new. If you look even at the diabetes guidelines, our country guidelines, and we called by WHO, they've called out this for a while in terms of co-bundling of these products that go alongside insulin, so that as you administer insulin or provide insulin, you also have the same place and time availability of these products, which is not usually the case. So the Diabetes Care Pack is an initiative, in a sense, to address the access issues and hope that you can marry the insulin with the availability of the products to safely administer insulin at the same place and the same time. So in a sense, addressing our access issues. So this project is being carried out across 5 countries. We have it in Kenya, Mali, Mozambique, Tanzania, and Uganda. And this is with the general support of the Helmsley Charitable Trust, but also several industry partners, including Sanofi, Novo Nordisk, Roche, and the International Federation of Manufacturers, International Federation of Pharmaceutical Manufacturers Association. We are beneficiaries of great partnerships, and I spoke to this earlier. And the Diabetes Care Pack initiative is also a partnership. Now, in terms of rolling out this partnership in country, we set out essentially to use this human-centered design approach to co-design these kits and also to evaluate the likely impact of this and then to pilot it. So not only are we basically looking at how do we do it, but we also want to generate the evidence in terms of what is this, in terms of the health impact and the cost effectiveness around this solution. And in this journey, we have worked very closely with the persons living with diabetes. We've worked with the patient-level organizations. We've worked with the NCD Alliance in Kenya, but also very close with the Ministry of Health, the healthcare providers, academia, and of course now the implementing partners. And the whole idea is to see, does it work? What's the impact? What's the cost effectiveness? What are the contents in the care pack? As Emma and Nupur have alluded to, it's really the products that help in safe administration of insulin. In this case, we're talking about the glucometers, test strips, lancets, alcohol swabs, syringes, and importantly, educational materials. So that's what you receive as what you call the initial pack. As you come for subsequent visits, you can get a refill kit, which now does not have the glucometer, but has everything else in terms of the strips, the lancets, and the syringes. And these are supplies which are coming in through the normal supply chain within the country. You're not instituting a parallel supply chain. It's really the same supply chain that brings in the insulin, but also brings in this kitting solution so that at the dispensing window, you're able to provide the insulin, but also provide that kitting solution at the same place and the same time, recognizing that access to the products has not been as it should be. And again, when you look at the process we have followed, remember I said it was a core design, evaluation, and pilot. Indeed, in this core design and using the human-centered design, worked very closely with the persons living with diabetes. They were core participants in the landscaping and the prototyping for this kitting solution. And then, of course, working with the supply chain colleagues in the industry, working with the Ministry of Health to make sure that indeed what is coming up as a kitting solution is what is available in country. So essentially it's saying to work with what we have in country in terms of registered products that we can work with. Importantly, and I think Emma called it out, we are glad that the essential diagnostic list of WHO now has incorporated the glucometers and the strips and everything. For us, that's important because then that mainstreams the availability through our national supply chain, and we are working very quickly to incorporate these new dimensions into our Kenya Essential Diagnostics list. We only updated it last year, but it looks like we'll need to do some further work towards that. So where are we with the diabetes care pack across the 5 countries? In all the 5 countries, we've done landscape assessments, essentially looking at what are the needs, talking to the persons living with diabetes. In 4 countries, we've been able to go to the users testing and prototyping stage, including Kenya. And for Kenya now, we are going into the scale-up phase where now we have a kitting solution which we'd like to take to scale. And in Tanzania, we're looking at doing a health market assessment to look at cost effectiveness. So in a sense, out of the 3 countries, we are quite a way along the continuum in understanding whether it's going to give us the desired health impact and the cost effectiveness we are looking at. Remember, in this access issue, we are trying to address 2 things. Availability, remember the same place, same time, insulin and the products, but also the affordability issue for us is particularly critical. So we are hoping with this, we'll be able to answer that question. As we improve availability, is it also cost effective in terms of affordability across the 5 countries? Thank you.
Thank you very much. I think this is an incredibly interesting discussion, and we could go on probably for another hour. I think today we've talked a lot about the continuum of care, the need for different products. We've talked about the power of partnerships, and we have really good examples of how partnerships with the private sector, but with others, can actually make this work, can enable this transformation. I think something that has come out loud and clear is bringing the voice of people living with diabetes into these conversations cannot be an afterthought. It's not something that is, as you said, Emma, like the cherry on the top, or something that comes after. It needs to be there from the outset. And also, I think I really liked your comment, Dr. Edward, around sort of proving this cost effectiveness and having an evidence-based approach to really ensure that we are delivering the best possible solutions in terms of availability and affordability for the people who need them. With that, I'm going to give you a bit of a challenge now and perhaps give you the floor for the next minute to tell me what for you would be your call to action. And it can be a call to action for different stakeholders, either the private sector, the device manufacturing companies, governments, or other implementing partners to really make this happen. And I would like to start perhaps with Emma, and then go to Dr. Edward and Nupur to bring this to a close.
Thanks so much. I'm gonna be naughty and take your one intervention and say two, because hey, I guess sometimes there are no rules. I'm just gonna bang that drum again about access to monitoring devices. I think, Life for a Child has had incredibly supportive relationships with industry, insulin manufacturer, and also glucose monitoring companies and HbA1c industry players as well. But more needs to be done here when it comes to glucose monitoring. I'm not going to say specifics, but just more needs to be done. Let's challenge ourselves more to close the access gap in the same way that is being done for insulin. I really believe that insulin is obviously a medicine, but glucose monitoring is in some ways just as therapeutic as insulin is when there's the education there. The second thing I will say, I think the biggest thing underpinning from our perspective at Life for a Child is the utter importance of continuing to uncover data deficits in global epidemiology. It is still far too common that countries have unpublished data or super historical data on incidence and prevalence of type 1 diabetes. And I know we're all familiar with the saying, what we don't know can't hurt us. But in this context, when we don't know how many people have type 1 diabetes in countries, those people are hurt, and they continue to be hurt by this lack of information. We need to raise awareness to the people outside of the type 1 diabetes global echo chamber, to the non-T1D traditional stakeholders, governments, ministries of health and finance, and also disruptive industry innovators too, the true scale of those living with type 1 diabetes and what they need to survive and thrive. And like I said, it's not rocket science, but I think, we have to say that governments have constrained health budgets, but really I'll say again that ignorance is not bliss for those who live with type 1 diabetes and their families who are losing years of life and health because access to medicines and consumables in their countries is either unaffordable or unavailable. This trajectory, it has to be in lockstep with all the big player commitments that I mentioned just at the start of this session. And when we do that, I think we continue to be well on our way to, in a sense, bulletproofing access for people living with diabetes. These changes, they won't happen overnight, but sustainable change never does. And I think finally, benchmarking and showing that interventions work in terms of reducing HbA1c levels amongst people living with diabetes, that shows that complications and mortality reduce. So we have to continue to have these evidence-based approaches here. And with that, and being, amongst Nupur and Edward, coming from such different perspectives, but all driven by the same goals, more or less, it's hard not to feel positive about the future. I don't feel positive every World Diabetes Day, but this year in particular, I am going to say that I feel positive.
Thank you very much, Emma. Dr. Edward.
Yes, Emma, on a positive note, there's been a lot of good progress, especially in this space of partnerships. But for me, my call to action and two quick ones would be one, and for me, the most important, and what we've learned along in this journey of the care pack is to involve the persons living with diabetes. For us, we have begun to understand not only do they define the most effective approaches, but then because of that lived experience, basically they shorten the loop to getting it right. So you avoid too many iteration loops and generate the evidence you need. So working with the persons living with diabetes has really been very important for us, and really working with these people with a lived experience to quickly understand the barriers they face, but more importantly, to design the solutions. So while our guidelines call for co-bundling or these kits, it does not tell you how to do it, how should they look, and we've benefited greatly from these persons living with diabetes. And really, we have to amplify their voice in all these platforms, in all these partnerships, just so that we get it right. And maybe that might help us to be able to match the exponential rise in the increase in diabetes and match it with action, funds, etc. At the same rate. The other thing that is important to us and a call to action is really looking at the products that are related to insulin administration. And I think, Emma, you spoke very rightly when you said that it's important to accurately measure and titrate your insulin to your specific needs at the time you need it, what you call the continuous glucose monitoring. And for us, if you're not going to be able to administer insulin with the right knowledge of the blood glucose levels, that essentially is life-threatening. So for us, the products that go along with insulin are very important, and 85% of the total cost to persons living with diabetes, and especially type 1, is due to those consumables. So again, looking at the affordability of those consumables for us is particularly important. Now we have them in the WHO diagnostics list. What more can we do to improve the pricing so that we make them more affordable? I have a sense availability is being addressed. Now we need to look at affordability and look at the pricing points along the way. But really to say, working with the persons living with diabetes and pricing points to improve affordability are particularly important in addition to everything else we have said. Thank you.
Last but not least, Nupur.
Thank you. I have two broad points to government and the private sector. But I want to begin by saying that our goal, all of our goals, are universal health coverage for everyone. To be in a world where quality healthcare is a reality for everybody, irrespective of where they live and what their income is. And to get there, we must ensure equitable access to diabetes care, especially for low and middle income countries. Emma spoke about the essential medicine list, and as did Dr. Edward. And while that's a really important benchmark, and we are glad it's there, what is additionally needed is the collective sort of will, most importantly, the political will at country level to make this happen. Governments need to, like Emma said, include people living with the condition in these multi-stakeholder discussions and conversations, and have diabetes as part of their NCD policies, not just on paper, but also in action, and safeguard their citizens against the high costs that come along with living with these conditions. We know that in low and middle income countries, 7 out of 10 deaths occur due to NCDs, and this is truly unacceptable. So that is to the governments. To the private sector, I think they need to focus on affordability and accessibility of medicines, devices. And I want to make a quick case in point. Abbott's Libre Pro, which is a unique sort of healthcare provider driven CGM in the rest of the world, but in India used by people that live with diabetes as well, is being made extremely hard to access currently, and that's a problem that the people are facing. These tools are important, and I think Emma and Dr. Edward really spoke to why, and I love that remote analogy about why this is so important. And without these tools, well, there's going to be a financial burden, there's going to be diabetes complications, people are paying out of pocket. So we need to have products that are really cost effective as well as practical and are tailored, if need be, to the needs of people that live in low and middle income countries. Again, we discussed generic and biosimilar insulins, which are also super helpful. I think in closing, I just want to say that I want to reiterate the focus that health systems need to be people-centered. I think everyone on the panel already said this, and education needs to be sort of remembered as a crucial aspect. It's not just access to insulin and test strips, but also the education and the support of communities and NGOs that need to be available for everyone that lives with diabetes. And our partnerships should focus on actual delivery, to make all of this a reality for somebody who lives with diabetes, whether they're in a city or a village or anywhere in the world. Thank you.
Thank you very much, Nupur. And I think this is a nice closure to our conversation today, with a strong call to action to the government, to industry, but actually to the ecosystem as a whole. And I just want to conclude by saying thank you to the three of you for spending your time today with us, to share your insights, to share these really valuable examples. And I think World Diabetes Day is always a good moment to take stock of successes and progress. I think it's clear that more work still needs to be done to achieve this continuity of care for every person who needs it. And I want to finish with something that Emma said just earlier on. Let's really work to close the access gap in the same way as it is being done for insulin, for all of these other commodities that we need. Thank you so much, and have a lovely rest of your day.